for some children to talk back, to argue, disobey, and even defy their parents or even the teachers, especially when the child is very much hungry or is under any kind of a stress or is very much tired. So during those situations they may just exhibit these kind of the behavior, especially if you take the toddlers who are around 2 to 3 years, or even for that matter the younger adolescent group of people. It is normal to show this kind of a behavior for the developmental age. But this kind of the behavior can end up with the problem, especially when the hostile and uncooperative behavior the child will develop, which is more consistent and severe than that of the other children of the same age group. Okay, where the child will end up with difficulty in his life in terms of social functioning, the family functioning, as well as the academic life, right? The topic which I'm going to talk about today is the oppositional defiant disorder. Yes, so it is one of the most common, disorders that you can note in the children as well as the adolescent group. I'm Mrs. Princey, Associate Professor in Mental Health Nursing. Right. So, what do you understand by the oppositional defiant disorder? A child with the oppositional defiant disorder, which is termed as ODD, consistently exhibit the behavior of being negative, disobedient, argumentative, as well as hostile. He behaves almost, frequently in a provocative manner, which deliberatively makes him to annoy or upset his authority. So here his authority can be his parents or teachers. So because of his kind of aggressive, hostile behavior, it is definitely going to upset his authority. The child will go to such an extent that during the argument, the child will not back down, that he see to it that his privileges are met. So for him, the important thing is the struggle that he does, wherein he overshadows the reality of the situation. So he will not understand the reality of the situation. For him, it is just important that his struggle is being achieved. That's all. If any person objects this kind of a behavior, he will take it as a stimulus, or he takes it as a stimulation wherein he continues to show the same kind of a behavior. So many, children who have this conduct disorders have had this condition, which is the oppositional defiant disorder. So we can simply say that oppositional defiant disorder may be a precursor to the conduct disorder. So let us see what is the definition of the oppositional defiant disorder. Oppositional defiant disorder is defined as the disorder which is characterized by enduring pattern of negativistic, disobedient and hostile kind of a behavior towards the authority figures, as well as an inability to take the responsibility for the mistakes, leading to placing blame on others. So that condition is termed as the oppositional defiant disorder. So here the child will have a difficulty in terms of controlling his emotions, or he'll be very much aggressive, he'll be very much hostile, he will blame others for his mistake, he will not accept his mistake, and he will always deny his authority figures, he will defy them, or he just does the opposite of what his authorities say. So we can say that he is very much disobedient. Okay, so that is the definition of ODD. Moving on to the epidemiology. It is noted that 5 to 15% of the school-going children have got this condition of oppositional defiant disorder. The onset of the disorder usually is between 3 and 19 years of age. So you can notice during the toddler period or during the early adolescent period, it is very much common. It is noted that before the puberty, the ODD condition is very much common in boys. After the puberty, you can even see in the girls. So both the genders, you can notice this problem after the puberty. Moving on to the etiology or the cause of the condition. So mainly we have got the predisposing cause, we have got the biological influence as well as the Family influences. So what are these biological influences? Nothing but it's related to the genetics, related to the biochemicals, so imbalances in the neurotransmitters. So all those conditions comes under the biological influence. Under the family influence, it is the influence of the parents, okay, wherein it can be a harsh disciplinary measures the parents may take, or overprotective parenting behavior that may have, or there may be a conflict in the family which can predispose a child to even imitate the conditions, right? So though both these influences can predispose a child to develop this oppositional defiant disorder. So we have got the other causes are there may be limitations or developmental delay in the child's ability to process his thoughts or the feelings. So if the child is having a poor developmental milestone, when the child is not able to process his thoughts well, so in those conditions there may be a chance the child may develop the ODD condition. The next cause is the lack of supervision from the parental figure or from the authority. So when there is a lack of a parent or a lack of authority, so whatever the behavior the child will develop, which is not accepted by the society, a negative behavior can also be practiced on, right? So nobody is there to recognize and correct it. So lack of supervision from the parents or from the authority figures can also make a child to develop this condition. The next cause is the neglect or the abuse. Any kind of an abuse the child had experienced during the childhood period, right? So the physical abuse, sexual abuse, or any kind of verbal abuse, so all these condition or neglect from the parents can even cause the child to develop ODD. Next is the inconsistent or harsh discipline from the parental figures, wherein the child becomes very much adamant, okay, because of the harsh punishments that the parents may give, or the inappropriate parental, pattern which can make a child to become very much defiant, wherein the child may start disobeying the parent. They become very much stubborn and adamant because of the inconsistent or the harsh punishment from the parental figure. So we have got the risk factors such as the parental rejection, inconsistent or unsupervised training of the child, inconsistent or punitive behavior or discipline, or setting certain limits, parental modeling of defiant interaction with others. Say for example, the child observes the parents, how the parents behave, with the others. They may just behave in a defiant way, right, with others. So a child who sees that may even model or imitate the parental behavior. In case of family conflict, marital discord between the child's parents. So these are the various other risk factors which can contribute for the development of the oppositional defiant disorder. Moving on to the clinical features. Number one is the argumentation behavior. A child will end up with a lot of arguments with the other children, or even for that matter with the parents or with the teachers at school. They may develop this argumenting kind of a behavior, wherein if his needs are not met, he feels that he doesn't calm down. When he keeps on argumenting, at times he may become aggressive in nature also. So they will lose their temper to such an extent they will become very much aggressive and anger. The next is blaming others. They always blame others. Okay, they don't want to take the responsibility for their own mistakes. Okay, they show the blame or they put the blame on others. They get easily annoyed by the other people. They seem to be resentful. Because of such kind of a behavior, they may have an impaired interaction or communication pattern with the other people. They may not develop good relationship with the peers or with his parents or with the teachers. There will be poor problem solving skills, and even they may end up with the depressed mood. Okay, so these are the different clinical features that you can note. So we have got the other signs and symptoms that can also be noted. Number one, persistent and inconsistent pattern of defiant behavior, being disobedient as well as hostile. Okay, consistently, continuously in any matter, okay, they are not able to obey their authority. They show the hostile behavior persistently. They may have this behavior of disobeying the rules and regulations directly. They may disobey the rules indirectly also by procrastinating as well as being sneaky. They refuse to cooperate. They are being very much touchy as well as easily annoyed. They may have frequent bouts of anger as well as resentment. They will pick a persistent, fighting kind of a behavior with the others. They will excessively argue. They'll become very much stubborn or adamant. They may even test the behavior limits of the others. They'll have lots of temper tantrums. They'll have deliberate attempts to trouble some other person or to annoy the other person, especially the authority figure. So by doing that, they get somewhat a kind of happiness, right? They want to deliberately annoy other person. You can also note a vindictiveness kind of a behavior, which is the revenge taking. So if something bad happens to the child, he see to it that he takes it as a revenge and he completes his revenge. He may blame others for his own mistakes or for his behavior. He may just put on his friend, or he may just, blame others for whatever he does. He always violates the rights of the other person, right? So these are the various signs and symptoms that you can note in a child with the oppositional defiant disorder. Moving on to the diagnosis. How do you diagnose the condition? So to diagnose the condition, you require the history or the assessment. You're going to collect the complete information about the developmental milestones. So people who are having a poor or delay in the developmental milestone, the children will have a poor thought processing. So important thing that you're collecting the developmental history. You'll be collecting the family history to find out the parental pattern of rearing, the connection or the affection towards the parents that the child shares, or any kind of a conflict that the child is experiencing in the family environment. So majorly these are the history that you're going to collect. So based on the history, then you're going to do an examination wherein you're going to note for these signs and symptoms, like if the child often loses the temper, arguing with the adults, the child who refuses to comply with the adults or the rules and regulations, child who deliberately annoys the people, who blames the other person for his or her mistake, who gets often angry and becomes resentful, and also most of the time being vindictive, right? That is nothing but takes a revenge, right? So you're going to find out if the child is having such kind of a behavior from the parents, from the teachers, or the authority figure. So when you know this kind of symptoms are there in the child, and by the history what you collect, you can diagnose the condition as having the oppositional defiant disorder. Moving on to the complication of the oppositional defiant disorder. So when the child is exhibiting this kind of a ODD condition, he can end up with a complication, that is, he can end up with the conduct disorders. He can become a juvenile delinquent also. It can end up with a condition called as attention deficit hyperactivity disorder as well. There will be a lot of problem with the learning. So he'll have a disability in the learning or the scholastic skills. So these are the various complications of ODD. Moving on to the management of ODD. So what is the treatment modalities that we have? Psychosocial needs as well as the psychological needs of the child as well as the family is met. And also to avoid the child to end up with the conduct disorder. So that is the goal of the treatment. So to begin with, the treatment focuses especially on the psychotherapy. So we may ask the child to undergo a individual counseling session or a psychotherapy sessions, and also the anger management techniques that will be taught to the child to control his anger or hostile behavior. They may have to undergo the family therapy, especially the parents and the child together may have to undergo the various family therapy sessions wherein the parents will be taught how to deal with such a kind of a child, so that they will be having a good communication between the parents as well as the children. So number one treatment is a parent training program. Okay, parent training program is nothing but we're going to train the parents, you're going to educate the parents as to how to deal with such a kind of the child, how to bring about a modification in his behavior. So there in the training program, you'll be educating the parents about the various faulty parenting methods that the parents may use. What is the appropriate method of parenting and rearing of the child? So in different situation, how they can handle the child's behavior which cannot be controlled. So all those things, the training program will be given to the parents. The next therapy is the anger management. So the child will be undergoing anger management technique where he will be taught about the various management. Say for example, the relaxation therapy, especially wherein there will be bird nesting. So, in this particular technique, it brings about calmness as well as quietness. So, you provide such an environment for a child which is very much calm, which is very much quiet, so that he just sits and he thinks about his behavior, he just calms down. Okay, that is bird nesting. The second one is balloon breathing. So, here in the balloon breathing, the deep breathing exercises that the child can practice by blowing the balloons, wherein he will be developing the slowness in taking the breaths, which calms down the client as well, and various other relaxation therapies that the child may have to undergo, like imagery, okay, dealing with or confronting with the anger situation, role playing, all such things can be taught to the child. The next one is the group therapy. So, in the group therapy sessions, the children with the similar conditions will be placed together with the help of a therapist. They will be giving a therapy to all the children. So, even in that, you can have an example of the child who has overcome this particular problem. They can witness, they can just give the witness to other children about their condition, how it has been improved, and how they have improved a lot by this therapy sessions, and also by modifying their behavior. Next one is the individual psychotherapy, wherein you're going to counsel the child. Individual psychotherapy will be given. Apart from that, the medication therapy, especially it is indicated to such an extent wherein the child will experience a lot of stress and anxiety. So, till then, that we may not require the medication regimen. If indicated, only the child may have to undergo. So, the next one we have is the family therapy, wherein the family as a whole will be counseled, and the parents and the child relationship or bonding can be developed by appropriate communication pattern. The next one is a cognitive behavior therapy, wherein you're going to bring about a modification in the cognition. The negative thoughts of the child can be replaced, modifications in the behavior can be taught, okay, new behavior can be learned. So, all those techniques which happens in the cognitive behavioral therapy. The next one we have the social skill training. Since the child has a difficulty to maintain the relationship with the others, because nobody would like to make friends with such a kind of a child, so this child will be isolated by other children. So he may have to undergo a social skill training, where they'll be teaching the child how to behave in a social situation, how to make friends, how to sustain the relationship, how to involve himself in the group activities, how to take up failures as in a constructive way. So all such things can be taught in the social skill training. So that is about the treatment modality or the management of the oppositional defiant disorder. Moving on to the nursing management. As a nurse, when there is a client with this kind of a condition, oppositional defiant disorder, what is your role? So we have got some nursing diagnosis that you can state for this condition. Number one is a non-compliance with therapy related to negative temperaments, denial of problems, and underlying hostility. The next diagnosis is ineffective coping mechanism related to retarded ego development and low self-esteem. The third nursing diagnosis, low self-esteem related to lack of positive feedback and retarded ego development. The next diagnosis is impaired social interaction related to negative temperament, underlying hostile behavior, as well as manipulation of others. So these are the few nursing diagnoses that you can state for the ODD condition. So what is the nursing intervention? The first and foremost important thing is you're going to develop the rapport. You're going to accept the client exactly as he is by establishing a trusting relationship or a therapeutic relationship with the child. So once you have developed the trustworthy relationship with the child, you can discuss the condition of the oppositional defiant disorder or the behavior that the child has exhibited with the child. Talk about this kind of a behavior with the child and see to it that you can set some limits on his behavior, or what may be the consequences of the behavior that he will show. So that can be discussed with the child. You can help the child to address his negative feelings or the negative behavior, especially related to the anger as well as resentment. You can teach the client the various anger management techniques, the relaxation techniques, so that he can control his negative behavior. You can even assist the client to deal with those situations which will provoke him or which will trigger his anger or hostile behavior. So you can teach the child to address those situations which will provoke his anger or his hostile behavior. You can set some strategies to control his negative behavior. Teach the child to learn to accept the responsibility for the behavior that he shows and not to blame others for his behavior. Teach the child how to express his anger in a better way rather than in a negative way, and also to control his temper. So again, here you can use the various relaxation techniques, the anger management techniques, which can be educated to the child, wherein you can practice those. Teach the child about the problem solving skills, as well as the role playing plays a very important influence on such a kind of behavioral modification, where through the role playing the child will realize the mistakes that he has done, and he will try to modify himself, wherein he can become more comfortable and develops that kind of a self confidence when he starts using the new skills. Okay, so through the role play you can enlighten the child to solve his problem, and also he can develop the better communication pattern. So whenever the child shows an appropriate behavior or shows an acceptable behavior, see to it that you recognize those acceptable behavior and you give a positive reinforcement to the child in terms of reward, in terms of contingency management, or in terms of appreciation, right? Which will motivate the child to practice the acceptable behavior more. So you can even interact with the family members, okay, as well as the child together, so that whatever the communication pattern they have within the parents and the child can be modified, and they can develop a good relationship wherein the child can be reared in a better way. Right? So these are a few nursing interventions that you can plan for a child with the ODD. Okay, so ODD condition, oppositional defiant disorder, is a condition wherein the child may develop during the toddlerhood period or during the early adolescent period, when the child seems to be very much hostile, disobedient, as well as defiant towards the parent as well as the authority figure. Right? So this condition can definitely be treated with the various psychotherapy techniques. Family plays an important role in bringing about modification in the behavior of the child. Hope you all have understood the topic. Thank you.